The government just announced $50 billion to save rural hospitals. But the same law that created it, it's what's killing them. Private equity in healthcare exploded from $5 billion to $100 billion in under 20 years. Wild, right? But here's what's nobody's connecting. That $50 billion rural health program, it might be accidentally handing Wall Street the keys. Stay with me because this affects your town. Here's the uncomfortable truth. The same law creating this $50 billion program also cuts nearly $1 trillion from Medicaid over the next decade. Follow me on this one. Rural hospitals run on Medicaid. That's their lifeline. So the government is cutting $137 billion from rural healthcare, then heading back $50 billion and calling it a rescue. That's not a lifeline. That's a debt trap with a bow on it. You want a real example? Athens, Texas, small town, low income, rural, one hospital, East Texas Medical Center, Trinity Valley. In 2010, a New York private equity firm called Cerberus Capital bought it, converted it from nonprofit to for profit, loaded it with debt, cut staff, cut services, cut corners. 2015, closed. No ER, no ICU, no inpatient beds. Just gone. When someone had a heart attack in Athens, the ambulance drove further, and the heart attack didn't wait. Cerberus walked away with an estimated $600 million. Athens got nothing. Now, here's where the $50 billion gets dangerous. Private equity firms don't need to create the crisis, they just wait for it to happen. When Medicaid cuts squeeze a rural hospital into distress, the hospital becomes a cheap acquisition target. Then the transformation grant money comes in, modernizes the technology, stabilizes the workforce, upgrades the facility. Just like that, taxpayer dollars just increase the value of a private equity firm's asset. Then they sell it, they profit, they leave, and you're still in that town. That's not a conspiracy. That's just how incentives work when there is no guardrails. So what do we actually need? Public money needs public protection, period. If a hospital takes federal transformation dollars, we need ownership transparency. Who actually owns this property? We need anti-extraction rules. No loading up debt while taking grants. We need clawbacks. If you close within 10 years, taxpayers get their money back. And we need access guarantees. You cannot eliminate the emergency room. Here's the truth, because when a hospital closes, the investors fly home, but the ambulance still has to drive farther, the stroke still happens, the baby is still coming. Healthcare isn't a business, it's infrastructure. And the question isn't whether $50 billion is enough, it's who's actually going to benefit from it.